Over the weekend, the Thunder Bay District Health Unit reported 16 new cases of COVID-19. But yesterday, 2 new cases were reported. It's the fewest number of cases to be announced on a single day since November 26th. However, healthcare workers are still dealing with outbreaks of the disease at nursing homes in Thunder Bay and Geraldton, in the oncology unit at the regional hospital, and at the Barrick Gold Mine near Marathon. There are about 110 active cases in the Thunder Bay area, with 3 people receiving treatment in hospital, 1 in intensive care. Dr. Janet DeMille is the medical officer of health for the Thunder Bay District, and she joins us this morning to help put these numbers into perspective. Dr. DeMille, good morning.
Good morning, Amy.
I'm sure a few people breathed a sigh of relief seeing 2 cases reported yesterday as opposed to some of the higher numbers we have been seeing. But what about you? What was your reaction?
You know what? It's always nice when I check in the morning and it seems like a low number of cases that we're reporting. I know that that means sort of more manageable work for my staff, among other things, because I know that they're working very hard. Mm-hmm. One is, I guess I'm always trying to be optimistic and thinking that it will settle. But it is really though misleading to look at what we're reporting on a day-to-day basis and try to interpret it, what it might mean on any particular day. It's really what we want to see is the trends over time, and even just a sort of some epidemiology things. It's actually, if you go to our website and look at the episode date, that's actually a much better way of monitoring what's actually happening in the community than the reporting date. In the reporting date, you'll see that the numbers go up and down significantly. Mm-hmm.
So what is the trend telling you right now?
You know what? I think it probably is telling me that we're relatively stable, but we're stable, I think, at still a fairly high number of cases for our area and our population base. So, and that's of course the reason why we're in orange, because we have a higher number essentially per 100,000 than we would really like to see. So stable, like it's not getting dramatically worse, but at the same time would really feel much better if I saw that number going down.
So too soon to say that we're flattening the curve then? Would that be fair to say?
I wouldn't say that at the present time. I think we need a little bit more time before I would really be comfortable in saying that we're improving or on a better trajectory. Mm-hmm.
I mentioned a number of outbreaks that we're seeing in the district, but the outbreak at Southbridge Roseview in particular, that one has been very significant. Are you able to give me the status of that outbreak at this time?
So what we've seen, of course, is a very significant number of residents having COVID-19 as well as the staff, so indicating and throughout the facility. So it is one of those really uncomfortable kind of pictures, although nice to see that overall there was, wasn't a lot of really serious illness, although, a couple of people did pass away, which is really unfortunate. But it is as well stable, but it's very, really have to maintain very strong infection prevention and control measures in that facility right now, which I know isn't happening, and it's regularly being reviewed in order to prevent further spread. It's really at a point of very, heightened vigilance, heightened action right now to be able to keep it stable. And then, of course, as people, both residents and staff, recover from COVID, then we'll start to see improvement. But certainly compared to where it was last week, I think it's in a better place right now.
Mm-hmm. We've also seen a growing number of cases in Marathon, I believe about 10 cases in that community. Yeah. What particular challenges or considerations come with dealing with rising numbers in a small community like that?
Well, always concerning, and Marathon, like some other district communities, really have done very well over this pandemic. But it is, nobody is immune. No community is immune to having COVID. And certainly as we're out and about and the reopening that really has happened over the course of the summer, where, communities are now more vulnerable. And what we've seen is, some cases in district communities, and some spread related to those cases, including at a work site, and some schools impacted as well, and households or families, and that's always uncomfortable to see. We work in those communities as well, strong partnerships with the healthcare, the assessment centers there. Really pleased to have that Northwest Superior Healthcare, NOSH, actually has their own testing equipment to be able to analyze the tests, which is really super. I have to say, I was always nervous about the turnaround time in those communities for tests and how difficult it could be to manage if there was broader spread of COVID in those communities. But the fact that they can actually do some of the priority testing and get that turnaround time really on those tests low is great. It's challenging. It's different than when we have sort of cases in Thunder Bay, but we manage them the same way, very comprehensively, and really trying to control any spread. And I think there's opportunities in smaller communities as well to do different measures. And I know that Marathon, for example, implemented some stronger measures around their municipal facilities, which actually could really help actually prevent any ongoing transmission of the virus.
Would you like to see more communities enforce additional measures like that?
You know what? I think it really should be dictated by what's happening in the community in terms of what's happening in the virus and the spread. And it is. I think there's, as I said, opportunities in rural communities, especially that are fairly isolated, to potentially put in temporarily sort of stronger measures. A little mini version of the framework, right? And I think it's nice to see that they're willing to do that and potentially get something under control faster.
Mm-hmm. Could you give me an example of one of those measures?
Well, I think I think they were just reducing or closing some of their facilities. So and encouraging people to stay home. Of course, really, that's a really big measure. And then sort of reducing, in many ways implementing some of the enhanced measures that are in the Ontario framework, but doing it at a local level.
Mm-hmm. In terms of the Ontario framework, where we're now in the orange category, how well do you think those restrictions set out by the province are working here? Are they stringent enough?
So the way I look at it, is hopefully they'll restrict or limit other outbreaks from happening. So we've had real challenges here with some significant outbreaks that have impacted, communities and facilities, and really impacted public health in terms of our ability to be able to follow up on this. It's very intensive work that we're doing right now, 7 days a week, and our capacity is significantly limited at the present time. So what I am particularly, comforted by those additional measures is that it'll reduce the likelihood of an outbreak happening or spread because of the limitations on people being able to get together, or the enhanced physical distancing, or limiting people, more active screening of people before going into places, because we really can't afford to have other outbreaks happening right now. I think we would. It's uncomfortable to think that other outbreaks could happen on top of what we're already currently dealing with.
The question we're now asking every week is there a possibility we could shift in that framework once again? Could we go up to red? What is your sense of whether things could shift again this week?
You know what? That's... of course we could potentially shift to red. I think people really need to realize that, we're in a difficult situation right now, and we really, I'm going to say, we all have to get our act together and do things as individuals, families, and in our workplaces, and to prevent this virus from spreading. We have too much COVID-19 in the Thunder Bay District Health Unit area right now, for sure. And if we can't control it, and it kind of gets a little bit more out of control, we will be going to red. We will be progressing up that. Do I think that's going to happen this week? I'm cautiously optimistic that we will be staying at orange, going into next week, just based on our numbers. But that decision actually gets made on Friday. But I think the way we're looking over the weekend and over the, what we saw yesterday, that bodes well for us, and we might see more people being resolved this week than new active cases. But that really depends, right? COVID comes out of the blue. It can appear anywhere. It can spread quickly, and we don't know what's really going to happen this week.
Dr. DeMille, I really appreciate the update this morning. Thank you for being on the show.
Thank you, Amy.
Dr. Janet DeMille is the Medical Officer of Health with the Thunder Bay District Health Unit.